Yes. There we go. Hi, Cam followers. I just want to say hello. My name's Amy. You haven't really seen my face before, but I'm going to be speaking to Nathalie tonight about massage and the senior pet. So, Nathalie, would you like to introduce yourself and tell us a little bit about you and how you got to where you are now?
Yep, thank you very much, Amy. Well, first of all, thank you very much for having me. I'm very excited to be speaking to Cam. Been following Cam for a couple of years now, so very excited to be on a Facebook Live with you guys. My name is Nathalie. You might hear from my accent, I'm actually not English. I'm actually Belgium. I live in Germany and I work in Luxembourg, so a little bit of Europe all over the place there. I have a practice in Luxembourg which is called FitDog, and I am a animal physiotherapist. I am also a Galen myotherapist and a canine fitness trainer. So there you go. In a previous lifetime, I used to work in banking, and so I converted about 6 years ago, basically, to work with something that's a passion of mine, which is to work with dogs, which was, the best thing you can do if you can work with dogs all your day long.
I agree. Dogs are just the best. So what was it that first sparked your interest in sort of massage of the pet and particularly the senior pet?
Actually, it all came back to my old dog, Jake. Quite often when you hear people talking who are in the veterinary practice, and I don't know if the same for you, there's always like some kind of an animal that brings you towards doing what you're doing. Yeah. And it often is the same with people doing, massage and physiotherapy as well. So I had my first dog, Jake, when I was still in, as I said, in finance. He was getting older. He was diagnosed when he was 8, I believe, with arthritis, and I had no idea what that meant. I think at that point I kind of thought, well, that's it. He's going to be dead in the next year to come. I was an average dog owner. I had no idea what it meant. But then I started looking into it. I heard about physiotherapy. It wasn't really available where I lived in Luxembourg at that time. I basically decided to overhaul my life and quit my banking job, study physiotherapy, and start doing as day-to-day work, basically, which is the best decision that I've done ever since. And then scroll a couple of years forward, Jake was getting older, and with him getting senior, I noticed that how much physiotherapy and specifically massage was helpful for him. So I then also did I think I graduated about 2 or 3 years from that one, the Galen myotherapy degree, whereby it's basically a degree that specifically looks into it's like a massage degree where there's a lot of we'll talk about that in a second, where we look at like the chronic pain aspect and how you can help your dogs. And I noticed how much that was helping him, and as well on a day-to-day aspect, a lot of the senior dogs that I'm helping, clients were seeing the difference from how much massage can help them. And I was getting questions of, can I do this at home, or, what can I do? So basically that's kind of where the entire, kind of as a background, from, going my personal experience into my professional experience, the interest for massage was coming from.
And when you talk about the differences that it can make to a pet that's experiencing pain and especially chronic pain, what kind of differences are your clientele noticing, or what did you notice with Jake when you started that journey of taking him to physiotherapy and doing some massage with him?
Well, I think of the main questions you kind of hear is that first of all, it's relaxing. Like, a lot of dog people, or dog owners, say how much their dog relaxes. Sometimes they fall asleep during their treatment, or they just sleep better following the treatments, like the night afterwards. So you kind of hear it quite often that people say, like, my dog, like if I ask them afterwards, like, how was after the treatment,
improved sleep quality. Yeah.
The one thing that they say is like they slept really deeply, so the sleep quality is really good. And as well, being like more loose, like, not being so stiff afterwards, like straight after when they had a treatment. So That's some of the main aspects. So of course the muscle stiffness, the pain, where we're trying to reduce that basically with a massage.
Great, that's fabulous, thank you. So I guess that rolls into the next question of why should we consider massage in the arthritic pet or the pet that we feel is painful?
Yeah, so I'm very much about trying to educate people to help their pet be as pain-free and mobile as possible. And Cam is doing a great job in that, about all the aspects and how to make an arthritic dog's life more comfortable. One aspect of that is giving massages, and basically with massage, there's different benefits of massage. So if you just take massage as a whole, not necessarily for purely older dogs, but massage is relaxing. It's a really good thing to work on the bond. It works, you increase the bond that you have with your pets. But also it will reduce pain because of massages, will increase the blood flow, it will increase the oxygenation, and therefore the pain and muscle spasms and all will reduce. So it's a really good thing, specifically in arthritic dogs who will have pain to some degree going on. It's a really good thing to basically make them, to make them feel more comfortable, to get them to loosen up a little bit. So it's from that aspect, it's a really good, really good thing to do, basically. Another thing as well, which is really interesting for if you massage, if you yourself try to massage your own older dog at home, is that, for instance, by giving frequent massages, you will learn to know what their body feels like, and therefore you will quicker notice any changes in their body. So there might be little things like little lumps and bumps that pop up that you might quicker go to the vets with it and just say, like, I just felt this. What do you think is the, should I get this checked, yes or no? But also, you might feel like by knowing what their body feels like and doing it regularly, you will feel differences and changes occurring, and therefore you can act quicker on it or refer the dog on quicker to a veterinarian or physiotherapist to further work on it.
Yeah, so here at CAM, we really support a multimodal approach when we look at osteoarthritis and especially our osteoarthritic patients. So it's great to discuss with you sort of the benefits that massage can make alongside some of the other sort of interventions that we can prescribe, like medication. Do you often work with pets that are already on pain relief for it, and then the massage is sort of an additional thing that you add in?
Yes. I mean, as you say, it's very much multimodal. Massage is not a replacement for a veterinary treatment, or definitely not for a veterinary diagnosis, but we very much work together with the veterinarians. Some pets will be on anti-inflammatory, some won't be. Some pets, after having some physiotherapy and massage, will be able to reduce potentially in cooperation with the veterinarian, will be able to reduce potentially the amount of painkillers that they're taking. But yeah, definitely, we have, it's beneficial to dogs on anti-inflammatory as it is beneficial to dogs who are not on anti-inflammatory.
Yeah. And sort of what considerations, when you're looking at a patient, do you look for when you're considering massage as a potential therapy for them?
As in the sense of, like, what do I consider if the dog is a good patient for massage, you mean?
Yeah, and sort of if a dog is coming to your clinic, what considerations do you think about before you sort of approach that patient?
Okay, well, there's a couple of. First of all, of course, when the dog comes in for the first time, you kind of you want to make sure that you read the dog correctly, and you basically do like a bit of an evaluation when they're walking around, so that you can kind of have an idea about posture and how they're moving around, and then. To be honest, most dogs are really well suited for massage because it is it's a treatment that is not scary for most of the dogs. Not all dogs are immediately happy with having, especially when it's a stranger massaging them. But then you just give them a little bit of space and, learn to respect their signs of discomfort. But otherwise, most dogs are really good for massages. And I think I typically in my treatments, although I offer the full physiotherapy spectrum, I typically start off with massaging them, because it's a good way of relaxing, of getting the dog maybe tuned in more with you. So there's really not or barely any aspects or any clients where I would say massage would be contraindicated for them.
I've got one question that's popped up from Kim Bates. She says, my girl is 16 and 2 weeks and has bad arthritis. She's currently on Metacam and gabapentin, and I'm weaning her off tramadol and maybe the gabapentin, but she struggles and she isn't very tactile. So how would you approach a patient that perhaps doesn't appreciate being touched? Would that be something where actually, how would you tackle that?
Very slowly. I've had dogs, to be honest, that have been so painful that indeed when you touch them, they might try to snap you, or they just move away. But you basically go about it very slowly, and you use massage methods that are very light on touch and not going to the deep massage method. So one very easy one that you can do, whether it's with your own dog or whether I do it on a patient, is just putting your hand on the dog, like on maybe his back end or his shoulders area, and just putting your hand there and keeping it there, because that is so without any movement. It's a calming move. But it still generates some heat under your hand, so it will have some beneficial effect actually. I am aware that some dogs don't like it from the beginning, whether it's because they're nervous or whether they're sore. You just go about it very slowly and use non-invasive techniques. As I said, try the, Kim, I believe it was, just try to put your hand on, like, I don't know which area of the body hurts, but try to maybe just put your hand over it and generate some heat, which will automatically happen. Under the hand might already, just that, as if that's only what you do, it might already have some beneficial effect.
Yeah, and from a veterinary perspective, I'm a vet, and I'm currently working in general practice. My main concern would be, is she painful actually, or is she anticipating that it will be painful when you go to touch a specific area? So I would definitely encourage you to go back to your vet, and perhaps if you don't like her being on tramadol, look at different options, because there are so many options that we have available to us with pain relief, and then perhaps adding in some complementary therapies might just help her relax a little bit. Yeah. So before we came on this call, we were talking about sort of the signs of discomfort and the way that you run your clinics, particularly sort of the fear-free method. What kind of signs of discomfort that are perhaps a little bit more subtle should we be looking out for as practitioners, but also as dog owners?
Good question. Good question. There's a lot of signs that our dogs give us, whereby often people, or I don't know, maybe practitioners don't always realize it. Typically, what we always say is your own dog won't bite you. So if you're trying to, touch your dog in a way that he might be painful, he typically is not gonna, turn back to you and bite you. He might try to bite me because I'm a stranger who comes into the equation, but a lot of dogs won't do that. So it might just be as simple as walking away. But the more subtle signs are just looking at me. So they basically, what they do is they kind of look back and like, what it is are you doing? But they'll, just the fact that they look back might be already a sign. Licking their lips, yawning might, it might be a sign of, I'm relaxing, but it might be a sign quite often, at least in my practice, it's going to be a sign of stress more than anything. So yeah, and then also holding their breath. So those are a little, some of the signs that they might be giving you that it's getting a little bit uncomfortable. Sometimes they just pull their, if I'm like massaging the arm, they will pull their arm away. But yeah, typically it's more subtle signs that they give you. It's very rare that I have a dog who tries to bite me. I think that just happened, once or twice, that maybe someone tried to snap me, but that's rather rare actually. So it is
And when you're sort of assessing, because you said that you sort of look at how they walk before you even start therapy, are there any, what are the signs that you're looking out for when you're sort of looking at that animal's gait?
I'm trying to assess where it is that they're painful, so where they're stiff. That was actually, well, we were discussing that before, aren't we? The Facebook Live that Hannah was having with Julia last week was about posture. So that one was a very good one. For those who haven't seen it, it's a good one to look the recording at that one. But basically what I'm trying to get is like, is a dog stiff? Like say I know it's a dog with hip dysplasia, of course they will be stiff in the back, but you will also notice the way they're walking, if they're maybe limping or stiff based on the way they're moving, or they're putting their feet up front. So stuff like that I'm trying to gauge. So based on that, I kind of have a mental map drawn up of, okay, these are the areas which when I'm touching them, they will probably be reacting. And then what I do is I start with the areas where I, based on what I assess with what I feel with my hands and what I see, I typically start massaging the areas that are less painful and then move toward the more painful ones.
Yeah, and I've got a really good question from Laura, who says she knows that trigger points can be a sign of pain. Can you explain a bit more about what these are and why they occur? Is that something that you have been?
Yeah, the trigger points basically are, well, what I call them are, well, if you mean not the knots, the muscle knots as well, which is basically an area where the muscle gets contracted. And so when the muscle is, when there's pain, you will have a muscle contracting and shortening. So which basically the muscle fibers go like this, which is the trigger point. So this can often, you have recurring trigger points. Like I have one on my back, and it's just because of bad posture or recurring bad posture.
Me too.
When you touch them, when I massage, I kind of want to hit my massage therapist sometimes when you put it on there. I really want to say like, stop it, because it hurts. But it actually, it's when it's massaged out in a certain, there's a certain massage techniques you can use for that. You do feel better afterwards. So trigger points are really, because of muscle shortening, like spasms that occur in the muscle. And you can try to massage, to break that out by massaging. I would leave that more for a trained massage therapist than try to do that at home, to be honest, because it can be painful for your dog. So yeah, I would rather maybe leave that for somebody who's trained in doing massage.
I've also got another question that says, when I stroke Charlie near his back legs, he leans into me and sometimes looks at me. Would you say this is a sign of him saying get off? And that's from Donna.
It's difficult to say. Just the way you describe it, it might very well be, look, I like it.
Yeah.
I would need a video with it. But leaning into you might actually, I would say that's maybe more, I don't know what you think, Amy, but I think I would say that's almost maybe more I kind of like this. Especially
I would say that's yeah. I would expect them to move away if it was something that was uncomfortable or sore. And
when I was saying before, like sometimes they look at you, it's more like when I sit behind them and like I'm treating their leg or whatever, and they sometimes go like, I know what you're doing. I'm you know what you're doing. So
it's so difficult because each dog is totally individual, isn't it? And it's you kind of get to know them through the journey that you go on when you're treating an animal, and you get to sort of know their quirks as
sometimes I trust the owner. Sometimes I have to, like this morning I had a dog and he was making like this weird groaning, like moaning noises, and I was like, is it a good thing or not? I thought, and the owner said like, no, it's fine, but I really couldn't tell. I think if my dog makes that noise, I would be like, something's up with her. So yeah.
Yeah. Yeah, and we were going to talk about this anyway, so it ties in nicely. But Laura's also asked a question about, is there a difference between massaging the younger pet versus massaging the more senior or older pet?
As with regards to the techniques that you use, or that a massage therapist would use, probably not. However, with the older pets, what I would do, especially when I'm teaching pet owners to massage their own pets, and also when I'm doing it, is that you need to go at it a little bit slower. So because the older pet typically is more, on average, more painful than the younger pets, considering it's a younger pet who doesn't have an issue. The older pet, because they're having more areas of soreness, you need to go slower and more gentle and lighter in your touch than the younger pets. Also, the older pet will probably be, if he has arthritis and he's been having that for a couple of years, he'll probably be compensating. So he will be pain-free, not necessarily just in one spot, but potentially in different areas of his body. So you just need to be more aware of pain in an older pet and how massage techniques might sometimes be sore, and therefore just go on the lighter massage techniques compared to when you're massaging a younger pet. And also the muscles will feel different. I don't know if you want me to go in there, but basically when you look at it's difficult to, you really need to have to compare a couple of dogs to kind of have a feel of what the muscles feel like. But basically, a healthy muscle should feel like chicken fillet, an uncooked chicken fillet. That's what we always learn. So if you imagine touching an uncooked, like a chicken breast, it gives a little bit, but it's not like totally squishy, and it's not hard either, right? So that's how a healthy young dog's muscle should feel like. In an older dog, you often have like it won't be like a nice bouncy chicken fillet. You'll either go totally through it, in the sense there's like no muscle left basically, or it might be very hard and like almost like a brick, meaning that it's overused. So that's kind of, very graphically speaking, how the difference in the feel of muscles between a younger dog and an older dog might be feeling as well.
That's really helpful, thank you. And somebody, I can't remember what your name was, but they've asked, do you use heat therapy when you are massaging or within your physiotherapy treatments? And is there a better time for heat therapy, e.g. before, after exercise? What your thoughts are?
For arthritic, so definitely heat therapy, good question. It's a very good idea to use heat therapy on arthritic dogs because it will help against pain. You might without trying to get too technical, when the dog is having like a a spike of pain, so to speak, heat therapy is going to be contraindicated, but you might want to discuss that more with your veterinary or physiotherapist. But as a general, heat therapy, I definitely advise people to use heat therapy, and I also use it at times in the practice. You can actually, what you can do is, if you have a sore dog, is you can put a heat pad over the area where you know that he's typically sore, and then gentle massage him afterwards, because it will be already, you pre-warm the muscle for him.
Do you recommend sort of a certain set amount of time to apply a heat source?
I would say about 10 minutes maximum.
Yeah.
Yeah.
And do you use cold therapy as well?
From a massage aspect, not. With exercise, I do. But from a massage aspect, I don't use cold therapy, no.
Fine.
But you really want to heat the muscle up before, or keep the muscle nice and warm. You can always put a heat pack on after the massage as well to kind of get it going. But with really sore pets, doing a heat pack before is not a bad idea, actually.
Okay, so it just like helps everything to relax a little bit more for the actual therapy.
Yeah.
So I've got loads of questions. I'm trying to keep up. So someone's asking about Ttouch, and if you've ever come across that, and whether you use that within your work.
I've heard of Ttouch. So Ttouch is Tellington Touch. It's a very soft massage technique that is based on kind of like a circular movement, where you almost glide over the skin. So when you basically glide over here, well, you can't really see on my hand, but you glide over it and the skin should almost barely wrinkle. I am not trained in Ttouch. I know that you can, you have, I guess, you have people who are Ttouch trained specifically. So I only know of one Ttouch move that I teach people, which is of the, I'm grabbing my own ears, but it's of a dog's ears.
Yeah, it's the relaxing technique.
It's the relaxing movement.
Yeah.
Yeah, Ttouch, there's a lot of different massage techniques that exist. And I guess every massage therapist, you kind of, use those that you are most, that you for yourself find most beneficial. And again, Ttouch is probably a great one. I'm just not hugely familiar, and I don't typically use it on a day-to-day basis. But it's definitely, it doesn't mean it's definitely a good one.
And the other question that they asked was, do you mainly massage sort of pets that are painful or chronically painful and are symptomatic in that way, or do you use, are you involved with fitness or canine conditioning sessions, or dogs that are perhaps agility dogs with massage before and after an exercise session to sort of reduce injury during those high energy bouts of exercise?
You can do both. I typically am more, because I'm more really a physiotherapy practice. So typically people who come to, I do fitness as well, but the majority of clients who come to me are for physiotherapy clients. So that means that they have some kind of an injury. And as a result, you do more massage as a, to work on the injury and to work on the pain. But you totally can, and I also do teach the clients who I do have, who occasionally come in fitness, or when I do agility classes, you can do a massage as a warm-up and as a cool-down. It's a bit of a different technique. It's a bit more vigorous than you would do. Specifically, the warm is a more vigorous technique that you would do compared to a massage of a dog who's there for physiotherapy. But you can definitely use it. I would say, without going into too much of the fitness side, the best fitness warm-up is still doing your little exercise routine as a warm-up. But you can, I think, massage as a warm-up and as a cool-down definitely has a place.
Great. So I know that you had a little video that you wanted to share. Does that link in now?
Yeah,
Shall I show that?
So I'll just let people know. So it's basically took a little video of my dog Jazz. Now Jazz is not an old dog, but it doesn't make a difference really. So it's a video of one technique called Effleurage, which is a stroking technique, which I kind of thought, like, if I show one technique to you guys that you can learn, which is an easy technique to learn. It's an easy one that you can actually start practicing this evening on your own dogs. And just that one technique will already be beneficial if you want to try to do a little home massage on your dog. So yeah, if you want to go ahead and I'll talk you through it.
Okay.
So, stroking technique. And there you go. So it's
working? Yeah, I think that's working.
That's fine. Perfect. So it's a technique that you do with a flat, open hand with like closed fingers, a relaxed hand. And you always massage in the sense of the hair growth. So that means basically from the head towards the tail. And as you can see here, they are basically, what I'm doing is they're long, soft strokes all the way from the head to the tail that you repeat over and over again. And what this technique actually does is that it relaxes the dog, and it will also warm up their muscles locally. It's the technique that you always start a massage with and you end the massage with. But as I said, if you do just that one technique, so you go from the head of we can rerun it again afterwards, maybe again, Amy.
Yeah.
Basically you can cover the entire dog. Let's just start, see this again.
Do you want me to go back to the beginning?
Let's start from the beginning again, if you wouldn't mind.
Yeah.
I'll go over that again. So again, flat hand, and what I do typically in the beginning is that as I said, I take long strokes from basically the neck all the way towards the end of the dog, towards the tail. That means try to not put pressure over the spinal cord. That's the only thing. So over the spinal column. That's the only thing that I would like to say about that. So gentle.
So for those of you watching, I don't know whether can you see my mouse there? Just pointing at the spinal cord.
Yeah.
So that's the bit that Nathalie's talking about that you don't want to press too hard on.
That's really the only thing to remember, is to not put pressure on there. And then you can start doing, as your dog, of course this video goes quicker than you would do it in real life, but as you feel your dog relaxing, you can start doing your movements a little bit slower, and then also do the stroking on the legs. So I kind of lifted Jazz, that's my dog, leg up to kind of show it for the video. You don't necessarily want to lift it when you're doing it yourself, it's just for video purposes that I wanted to just show, to basically include stroking over the legs as well. So you kind of do the back, you do the legs, you can go all the way down the chest as well. I mean, as you can see, I mean, right now she's sitting up, but she really, she really likes that. So you can easily just do that for like 10, 15 minutes on your dog, and that already as such will have a benefit. And as you said, it's really an easy technique. You can't do anything wrong with it. You're not going to hurt your dog doing this. So not being afraid, don't be afraid. Just be long, gentle, and without too much pressure. I think that's the main thing to remember.
Great. That's lovely. And so I think the last question on my list is talking about massage at home versus massage with a professional.
Right, so massage at home, you can definitely learn how to massage your dog at home, and I would definitely encourage people, if you're interested, to do that, to try to take some lessons on that. It of course will never replace a massage done by a professional, because the professional will typically also do certain massage techniques that are deeper, where you probably need to have a better understanding of the canine anatomy and of the physiology and all that. So I would say the massage at home is a good complement to having massage done by whether it's a physiotherapist or a trained massage therapist, whatever is available in your area. And if you don't have anybody available in your area to do that, depending on where you might live, then definitely a home massage I think it's a great thing to do on any pet. But specifically, if you have a senior pet, it will, for most pets, it will be beneficial. It will help them feel more comfortable and make them feel better. And again, just be aware that massage treatment is always going to be a complement and never a replacement to what, a veterinary treatment. And, speaking to your vet, or speaking to basically the entire team that you have around your dog, basically.
Yeah, that's perfect. So I think I've answered all the questions. There's so many. I think I've asked them all, which is really great. It's really great that everyone's like really interacted with this.
Yeah.
I think there's one sort of vetty question that wasn't to do so much with massage. Oh, here, Lisa said, my dog has been on Onsior for over a year now and has regular upset stomachs. Could this be the cause? So it's not related to massage, but I just wanted to say it would definitely be worth contacting your vet about that, because Onsior can sometimes cause upset stomachs, although it may not be the cause. It could definitely be a contributing factor. So just if you're listening, Lisa. Is there anything else? I don't think that there has been any other questions. Do you have any last sort of comments that we haven't discussed, or you feel we need to discuss, Nathalie?
No, I would just say, honestly, try to don't be afraid. Don't be afraid of trying to give it a go with your dog. Give a try with the little Effleurage technique that I showed you, and you can look at it again if you I guess after the recording of the video, if you want to look at it more slower. But yeah, don't be afraid. Give it a try, and if you haven't given massage therapy a thought before, to maybe go to a massage therapist with your dog, or speak to your vet about it. Because I definitely think there is a lot of good that can be done with that kind of treatment. And as I said, most dogs really like it, either immediately or they will learn to appreciate it.
Yeah, absolutely. No, there's no other specific questions. There's one about rocking, but I'm not quite sure what that is.
Okay.
And just, I think if you did want to learn more about it, I know, Nathalie, you have a website, don't you?
Yeah. So if for those who are interested in learning massage, specifically for senior dogs, you can actually go either on my name, go to my website, which is fitdog.lu, because it's a Luxembourg-based company, or go to the Facebook site, and there's actually an online course that is available, which is a do-it-yourself course with practical videos and all. Or drop me a note, and you can actually, learn in there how to massage your own senior dog. So if you have any questions, just drop me a note. I'll be more than happy to explain more about that.
And I think it's always a discussion with your vet, and they can refer you to a physio as well. And often, once you're referred to a physio, your physiotherapist may well give you exercises to do at home to help strengthen muscles in certain areas where your dog needs it. Yeah. So it's been lovely talking to you, Nathalie.
Thank you very much. Thanks very much for having me. I hope people found it interesting.
I think the comments have been really positive. Everyone's saying how much they've enjoyed it. So that's been really great. Cool. And how useful the demonstration of the Effleurage technique has been. So thank you for that.
Yeah. I'll go thank my dog. I think it's a good model.
Right. Okay. We're going to say goodbye, Cam followers. Until next time.
Thanks, everybody. Bye.